Genesis is a large IPA in Dallas, has a long history providing contracting services for its members, over 1,400 physicians that are really in small mom and pop entrepreneurial type businesses. Core components of being accountable for care mean that physicians have to do something different than they're currently doing. And that might look like being more attentive to needs of patients after they've left your office.
There are a lot of solutions, but nothing that communicates clearly and brings all of the different players into one system.
The product idea that we developed had a lot to do with both what a care navigator does in engaging patients and how to capture that information, but also how would we engage the physicians in the care navigation process.
Care Navigator helps us communicate easily with patients, family members, physicians, and ancillary staff. It's the brain behind our communication system.
So we structured Care Navigator to where it was kind of a parallel system to the electronic medical record of a hospital or a physician. So at the end of the day, we documented what a Care Navigator was doing day in and day out with patients, particularly focused on the non-clinical activities.
I think what we're doing with the Care Navigator product is obviously starting to put some more focus on those social and behavioral barriers, because we really feel like that's where the system needs to start paying more attention if we really do want to provide higher quality care at a better cost.
One of the greatest stories we have is a patient who really was very bright and understands her disease, but she has a problem getting her medications, specifically from a pharmacy, and her daughter lives out of state. And so it's really been an incredible tool to be able to communicate directly with the daughter and with the patient and coordinate that like as if they were in the same place. Now that we have been able to communicate with her daughter and have that supportive role, she's not been to the ER and has been very stable.
The mobile app of Care Navigator basically extends the ability to see care navigation take place while you're doing other things other than being in the office. Where the mobile app has its greatest opportunity is the connection with the patient's caregiver, the physician, and the Care Navigator all together can be part of that care team. So that's, I think, where the power of the mobile app is going to really come into play.
We see care coordination as a really key strategy for reducing readmissions, reducing admissions before they happen, and helping manage the overall quality of care for a patient.
Patient engagement is all about empowerment of the patient and their ability to really interact with their own health care and take responsibility. Our goal at the end is to have a patient who's self-managed and can learn how to navigate through healthcare barriers.
Care navigation is a critical success factor for Genesis because of the ability to capture the imagination of our physicians that something is changing, that the care that they're delivering to their patients is going to be significantly different going forward than it has been in the past. I believe that's going to manifest itself in improved quality, improved satisfaction, and reduced costs.